Hello, good evening and welcome to the late-night edition of TVB News. Another day of double-digit infections. The city reported 44 more coronavirus cases, including 2 at the Kai container terminal. As Sharon Tang reports, one is a recovered COVID-19 patient that may have been reinfected.
Attention centers around a 33-year-old local man who works in the IT sector. He was sent to hospital after being confirmed with COVID-19 in March. A month later, 2 of his samples tested negative for the virus before he was discharged. Earlier this month, he traveled around Spain and returned to Hong Kong last Saturday. This time, his samples tested positive, but authorities believe his virus load isn't high.
Our understanding of this virus evolves during the pandemic. I think there are 2 main possibilities. Either it's a persistent carriage of the virus, but he has been tested negative during discharge. And the second possibility is reinfection. So I think this needs to be thoroughly studied by some experts with more tests.
As for the infection clusters, 2 more drivers working at the Kai container terminal came down with the virus. They're not staff members of Jacky Operations Services, where 1 more worker has initially tested positive for the virus. 1 more domestic helper who stayed at a virus-hit hostel at Cheung Hing Mansion in Mong Kok has also tested positive. Starting today, the Lei Yu Mun Community Isolation Facility will be under renovation that would facilitate medical workers to remotely consult patients in future.
We will install more Wi-Fi as well as to upgrade the electricity for further use in the coming future. So at this moment, the patients will be transferred to the 2nd-tier isolation ward as well as in the AWE when they are waiting for the discharge.
Meanwhile, 13 imported cases today involve arrivals from India, Russia and Ethiopia, as well as Indonesian domestic helpers. Sharon Tang, TVB News.
At least 65 COVID-19 infections during this outbreak originated at the Kai container terminal. That's prompted one union to ask for more dock workers to be tested. Jacky reports.
This terminal is among the world's busiest container ports. Now it's also among the city's most active for COVID-19 testing. Ken Lai, representative of the Union of Hong Kong Dockers, says dock workers don't have much physical contact with deck crews. But it's still possible that they can catch the virus indirectly from infected mariners due to the numerous steps in offloading items. Port management officers first check cargo information when vessels arrive. The cargo is then unloaded by dock workers, the cluster with the most COVID cases. Finally, the cargo is double-checked before being dispatched for delivery. Around 2/3 of infections at the terminal work for Jacky Port Operation Services. Ken Lai says stevedores from the virus-battered company mainly work at container terminals 1 and 2 and share the same communal facilities. He says the chances of infecting the workers with other companies are minimal. While Jacky has suspended operations, the union believes there's no need for the entire port to do the same. Lai says the source of infections is most likely the seafarers and suggests rapid testing be administered to all sailors before letting them board the vessels. Jacky, TVB News.